Y'all, I'm excited to have Dr. Khadijah Cyril with me today to talk about narcissistic personality disorder and its impact on relationships. We discuss the differences between normal, harmful behaviors that people may engage in, like lying and cheating, and how that looks different when someone actually displays narcissistic traits or narcissistic personality disorder. So if you want to learn about this topic and some ways on how to get out of unhealthy relationship dynamics, this episode is for you. Welcome back to Savvy Psychologist. I'm your host, Dr. Monica Johnson. Every week on this show, I'll help you face life's challenges with evidence-based approaches, a sympathetic ear, and zero judgment. You all, I am so excited today. I have Dr. Khadijah Cyril with us. She is a longtime friend and colleague of mine, and she's an expert in narcissistic personality disorder. And she has so graciously given me her time so that we can have a chat and learn more about narcissism and narcissistic personality disorder. So thank you so much, Dr. Cyril, for being here today.
Oh, I'm really glad to be here. Thank you for having me.
Just to get the conversation started, one of the things I've noticed is that the term narcissist and also narcissistic personality disorder are thrown around a lot in the media. And being a psychologist, one of the things that I notice is I just have a strong reaction because a lot of the things that people are labeling as narcissistic personality disorder, and just so everyone knows, we may use the shorthand of NPD, just so that we don't have to say narcissistic personality disorder this whole time. And so a lot of things people will call NPD, I'm like, ugh, that's not actually the disorder. So could you talk more about kind of what is actually NPD and kind of where do we get it wrong in the general public?
Okay, so that's a good question. So, NPD is a pervasive form of grandiosity. It's a mental health condition that you would find in the Diagnostic Statistical Manual, right? It's an onset of different characteristics, including grandiosity, maybe a feeling of self importance, entitlement, difficulties with emotion regulation. Lack of empathy, and it's usually a set of characteristics that impairs the functioning for that person, right? So that person has difficulty forming relationships, performing in work, right? And I think what marks narcissistic personality disorder is it's a clinical condition that is impacting that person, right? And so what's different from what's going on in the environment is people using that term more loosely. It can make it seem like more people may have narcissistic personality disorder when really it's a condition, right? And so the same way somebody who is anxious doesn't necessarily have general anxiety disorder, right? So the same way all people who experience narcissistic personality disorder have narcissistic tendencies, but somebody who has narcissistic tendencies does not necessarily have narcissistic personality disorder. So it's important to make sure you have that distinction, to make sure you're not labeling people with a personality disorder when really it could be just a pattern of behaviors that's really impacting you as opposed to that person's functioning. They could be fine, right? But it's you and your relationship dynamic with them that's really troubling.
I mean, so part of what I'm hearing you say, just to clarify some of this distinction for the general public is that there's so many characteristics or things that could be a clinical issue that is quite normal and within kind of normal limits of like being a human being, right? So for example, someone could be selfish, but being selfish doesn't necessarily mean that you're a narcissist. But there are people that are really selfish and they cause a lot of harm in their relationships.
No, yeah, I agree with you. I think that's a good point, right? There are people who could be selfish or self-centered or maybe arrogant or full of themselves or love their looks, right? That doesn't necessarily mean they're narcissistic. And also, if somebody is using that term, right, whether as a therapist or as a friend, I really want to explore why they're using that term, what's going on. Do they mean this person is selfish, right? Or is this person experiencing a pattern of abuse, right, that is leading them to use that term, whether they're getting the information from media platforms or from their own experiences and hearing it around them. I'd be curious to know more. But yes, right. Somebody being selfish doesn't necessarily mean they're narcissistic. However, if somebody's using that term, I would want to explore more and understand why they're using it and how they're using it.
Sometimes I work with people and they've had really poor relationships. So they've been with a person who lies a lot, or they've been with a person who's cheated on them either once or multiple times. And, that leads them down the pathway of, I'm in a toxic relationship. And then toxic relationship usually leads them to, I'm dating a narcissist. That's kind of like the algorithm chain that I find that a lot of people find themselves on. Can you talk some about the relationship dynamics and kind of what's different between someone who's actually in a relationship with someone who has NPD and then someone who is in an unhealthy relationship for sure? But again, it's like within that normal limits that we're talking about.
That's a good question. So, usually, if somebody's in a relationship with somebody who has NPD or narcissistic tendencies, right, it's categorized by a pattern of love bombing, then maybe some devaluing, then discard, then hoover. And you see that pattern going on in that relationship, right? And love bombing really looks like idealization, right? They might mirror the kind of person you want, a lot of admiration towards you, compliments, praise, right? And then maybe they get triggered by something you do or say, and then after they start to devalue you and belittle you or minimize you, invalidate you, and then they might discard you, right? Whether it's through literally leaving the relationship or silent treatment, and they might do hoovering, whether they try to go get back into your good graces again, and then that cycle is repeated. Right. And so when you're trying to assess is this person experiencing narcissistic abuse, right, you're trying to see if there's some on again, off again dynamic that's going on that's putting this person in what some people use as a trauma bond relationship dynamic, right? Compared to an unhealthy relationship dynamic can look like, I'm having difficult, I express my feelings, they're not listening to me, right? We have difficulties with communication. I want to be with them, they don't want to be with me. Like, I would really need to understand what's going on in that relationship to really assess, right? Is this a pattern of narcissistic abuse, right? Or any type of abuse, which is usually cyclical? Or is this just an unhealthy relationship that maybe it's time to leave, right? So you brought up the point, Dr. Johnson, around cheating, right? So say your partner cheats on you and you're bringing that to their attention and you're like, hey, I felt really upset that you were texting this person, or this person is telling me that you have been contacting them, right? I would be curious to see how they respond, right? Are they showing like remorse or empathy? Are they really listening to you? Are they validating your experience? Are they expressing why they did that behavior? What happened, right? Are they able to regulate their emotions? Are they able to make space for you? Or are they blame shifting, right? Well, you made me cheat on you. You weren't giving me affection, or your looks, or minimizing you in some way where they have now made themselves the victim and they have minimized your feelings and replaced them with their own and made them the center of attention, which is really the hallmark of a narcissistic person, right? They will change a dynamic to make themselves the victim, even when they have caused the hurt, compared to maybe an unhealthy person or an emotionally mature person may not be able to understand how you feel, but they're not going to center themselves, right? And in the same way a narcissistic person will.
Yeah, that makes a lot of sense. And something that you said made me think about kind of dating dynamics that come up these days, because you were talking about the pattern of like love bombing and like going through those phases. And I think something that I'm noticing and something that like patients bring up to me is that sometimes that seems to be the standard kind of feeling of the dating dynamic, because a lot of people meet on dating apps these days. They may be hot and heavy for like a couple of weeks or a month, a lot of texting, a lot of, affection and like going on dates. And then there's that disappearing act that happens, right? Where like people get ghosted and then you don't hear from the person for several weeks or a few months, and then you get that text message. Okay. You get like, how you been doing? Or I've been thinking about you. As you were talking about that, I was thinking about that dynamic. And I know that's not the same as NPD. Dating is different these days. I think everybody feels some of that like energy. So is social media, are the dating apps like causing us to act a bit more narcissistic than we normally would?
That's a good question, right? I think I've seen this a lot with my patients of different ethnicities and gender that dating has become difficult, like to the point where there's been language around describing certain, we'll say, unhealthy or unhelpful dating dynamics, right? Whether it's breadcrumbing, a person coming in and out of your life, right? And then slowly leaving it, as you describe, or ghosting. A new one I've heard is orbiting, right? Where they have like stopped communicating with you, but still follow you and like you on social media, right? And there's the reason why there's these words exist because it demonstrates a pattern of behavior that is collective. And so we all have a shared understanding of what that word means so we can communicate. So like snow, right? We all know what snow is. And so we use that word to describe what snow is, right? So when we have words like breadcrumbing or ghosting, we're using a word to describe a pattern. So we all have a shared understanding. So you're asking, has people become more narcissistic in relationships right now? I think with the launch of dating apps, it's created a platform for people to be treated more as a commodity as opposed to a person. And part of some narcissistic tendencies is the superficiality of it, right? Beauty, power, money. And so sometimes it can create this culture of where I'm going to focus on these superficial standards. And if you don't meet these superficial standards, I'm out, right? So you're picking a person like you would pick your groceries or furniture on an app. So I think it does lead to those type of unhelpful healthy behaviors. Would I then say those people are narcissistic? Again, narcissistic abuse or being in a relationship with someone who has narcissistic personality disorder, right? It's really a character, it's really a pattern of behavior that has a certain dynamic and element and cyclical nature to it that you will see whether it's romantic or in a friend relationship or a parent relationship. But people can engage in certain behaviors like ghosting that, of course, is unkind, but I don't think that necessarily makes them narcissistic. It just it's become a part of the culture in some ways.
I mean, I think part of what you're pointing out is how much nuance goes into these situations. And it's not that people are wrong in thinking that some of these qualities or characteristics are narcissistic, but that they also need to understand that in order for something to meet a clinical definition, it requires way more data points. And some of those data points, someone in the general public may not know how to search for those or what they look like.
Right. It does require way more data points and patterns. And I would want somebody who has experience working with people with personality disorders to be diagnosing that person. But oftentimes, people with narcissistic personality disorder don't show up to therapy, right? Part of that grandiosity is keeps them from therapy. Like, I'm fine, you're the problem. So, uh, if somebody is expressing, concerns about a person engaging in narcissistic tendencies, I in my practice, I tend to believe them and I want to explore it and understand what's going on. What is making you use that language? Again, is that person selfish, self centered, or are you experiencing a pattern of abuse? I tell my clients I like to hold up a mirror to their face and then I will express to them what I'm noticing and seeing. So, yes, I don't think it's great to diagnose someone. Even like, within my personal life, I don't go around diagnosing people. If someone I'm noticing a challenge, I'll say, hey, I think it might be helpful for you to going to a therapist. But I do agree with you. There is nuance to it. So I wouldn't go around diagnosing people, especially when you have social media and you get these short clips, right? And it can create confirmation bias, right? Well, hey, the person I talk to talks about themselves a lot and they admire themselves. Maybe they're a narcissist and they have narcissistic personality disorder, right? And these short 30-minute clips that you might be seeing on social media platforms won't really give you an accurate reflection of someone. There's a lot of nuance to it. There's a lot of behavioral patterns that you have to really assess. And so I would not diagnose that person. However, if you are thinking somebody does have narcissistic tendencies, I think you should trust yourself and really explore what's going on, what's making you think that, and seek professional help and guidance to really explore why you're feeling this.
Oh, I think that's the most important piece is what you're saying of like trust your gut, trust your boundary signals that are going off because there's a lot of things that are harmful that don't get to the level of someone's going to go to the doctor and get a diagnosis for this thing, right? And a lot of the patterns that we've pointed out, I think one of the things that you were talking about in terms of the devaluing of people, right? And in terms of how we date, it causes us to sometimes act in ways that could be harmful to other people because we've allowed ourselves to not see, okay, I'm looking at you and going, hi, this is Dr. Cyril. She's a human being that has a life and emotions and like all of these things. But we get to the point where if you're on a dating app or after the pandemic, obviously we had to keep so much distance from one another, and that may be a variable in this as well. But I do think that we've gotten in the habit of not valuing each other as much. So then it makes it easier to dismiss a person, or I think you use the word discard another person or devalue another person or dismiss, ghost, do all of these things that like, not to say that it never happened before, but I don't think it happened with the regularity as like it used to be a really big deal if someone stood up a person. Like if you got stood up on a date, it was like a notable like experience of like, oh my God, what happened and how could this happen? And now it feels like it's quite common for someone to just ghost you like right before a date or right after a date. And it's just a part of the dating process.
hmm I'm hearing about my patient's life and they're exploring online dating. That is a part of it, right? You may never know why they have ghosted you, or you've never heard from them again, or they breadcrumb. We don't necessarily know the thoughts and feelings and experiences behind that person's decision. I think also we have created a culture around dating that allows it to be acceptable in some ways, right? In forms of communication, when really it's not healthy, it's unkind, right? If you're not interested in a person, you can simply say, it was really lovely getting to know you. These last couple of dates, I'm deciding to explore other options. That would be more appropriate. I hope we kind of move away from ghosting or breadcrumbing and really just express and communicate, big on communication. But I will say that those behaviors, if you're in early dating stages, like you went on 1 to 2 to 3 dates with someone and they ghost you, I wouldn't necessarily say, yeah, that person although they could have narcissistic tendencies, I wouldn't say that you could use that to classify them as a narcissist. It's an unkind thing to do, but there is a culture piece to it that's made it more socially acceptable, even though it should not be acceptable. But I agree with you. Standing someone up, ghosting, it used to be unkind things, and now it's become more prominent. Like again, I hear it so often now in my private practice that I try to normalize that person's experience and validate them, even if it's not an experience that people should be engaging in or experiencing.
Just so that we can further kind of clarify the distinction here, can you kind of walk us through what kind of a classic presentation of an NPD relationship looks like in terms of like the dating process after you're already kind of in that relationship more long term? Like what is that? What is a kind of a classic example of that?
That's a good question, right? And I'll say NPD and like narcissistic tendencies, right? Because like not everyone who is engaging in narcissistic tendencies has gone out and gotten the diagnoses, right? Because clinically, NPD is what, maybe 1 to 5% of the population, right? Because that's what makes something a clinical condition. It's a small part of the population, but there's a larger part of the population that does have narcissistic tendencies. And so what that relationship dynamic would look like. It would look like at first that person showering you with maybe attention and showing up in the way that classically we understand is to be romantic, whether they are, holding doors open, being kind, giving you compliments, paying for dinners, accepting invitations for dinners, on the other side of things, they are expressing their feelings to you, right? They are sharing their childhood traumas and wounds and their stress, right? They are validating your own experiences, and it could look like, wow, this person is a emotionally mature person, and I'm enjoying to get to know them, and they could mirror the kind of person that they think you want them to be, right? And so that's what it would look like early on. Right. And that's why when my patients are getting into relationships, I talk about the importance of consistency, right? Because you want to make sure that who they are in the beginning is who they are and continue to be for months and years on end. And so, but usually if somebody has narcissistic tendencies or NPD, right, they can't hold up that facade for too long. Inevitably, they are going to get triggered, dysregulated, get angry, and then they might invalidate you, name call you, blame shift, right? Because they, as much as they're mirroring this image of who they think you want them to be, they are also, it's a facade, it's a mask, right? They can't put that mask on for too long. And so then after that process would look like you do something that they don't like and they get triggered, right? It could be something small, as in maybe you showed up late to a date, or to something bigger, right? You express your feelings and they can barely manage and tolerate their own feelings. So it's going to be difficult for them to manage and tolerate yours. And so that might be look like the devaluing phase where, again, name calling, or they're not being as consistent as they once was. And then what that relationship would look like after the devaluing phase, right? It could be discard, right? As in they break up with you and you just went on this whirlwind thinking you found, a certain person that you could be with. And then after they discard you, right? Which could be very hurtful, or break up with you. I'll use that language. And then sometimes they might come back around and say that I've changed, and or present that pattern of behavior again that you made you first like them in the first place, where they're consistent, they're demonstrating the facade of emotional maturity, but obviously they may not have it because they can't keep it up consistently. And then that cycle kind of goes on again. And so each of those stages can last months, sometimes maybe even years, but it's usually a cyclical on again, off again dynamic that can be really hurtful for the victim that who's in that relationship, because they find themselves hoping and wanting that person to return to who they were in the beginning of the relationship, or the person that was mirrored. You find that they can stay in those relationships for a long time, right? Because think about intermittent reinforcement, right? Like that's how casinos work. Intermittent reinforcement, you don't know the next time that next token you're going to get, right? So you keep doing the token slot, putting your money in the slot machine, hoping to win, right? Because you can win the next time. It could take 12 more times, 5 more times, 2 more times, right? And then so you start to get like bonded to that person who is sometimes really kind and loving and caring and attentive, and then sometimes very hurtful and mean and abusive, whether through their emotionally, mentally, or even physically in some cases. And so when that person does not know what version of that person they're going to get, whether it's the kind person who's there, who demonstrated that behavior in the beginning, or the hurtful person who's kind of behind closed doors, it might keep that person in that dynamic, hoping that that person will return back to that kind person they fell for, and that person will consistently be that kind person they fell for. But usually you can find that individual in that relationship for years, hoping that person will maintain the person they were earlier in that relationship.
You bring up such a good point about the intermittent reinforcement, because I don't think people really realize like how kind of addictive that cycle is. I mean, it comes up in a lot of different things. It comes up in the cycle of abuse and relationships. As you already pointed out, it comes up in like gambling and sports betting and things like that. A lot of times people will say, why did that person stay? Or if you're the person who's in that dynamic, you feel so much guilt and shame about like why it's so hard for you to leave or get outside of that dynamic, because when it's good, it is so good. And then, when you go through the rough period or the discarding period where you break up, and then your brain always rewrites history, right? So you're thinking about the relationship and then you go, well, maybe it was me. Maybe I was making too big of a deal of X, Y, and Z because you start to remember all of the flowers and the trips and the times when he rubbed your feet when they were hurting. And you forget about the verbal abuse that may have happened, the emotional abuse that may have occurred, or the gaslighting.
Yeah, no, that's a really good point, and right, and that experience would be called your euphoric recall, right? I say to my patients that it's a biological wire to love and be loved, right? Newborns want to be loved and be to love and be loved, right? They need that attention. Sometimes when you're in those relationship dynamics that are unhealthy for you, your brain is going to want to recall those times where that person is loving you in the ways in which you want it to be loved, and so that's an experience too to it. And so you're going to want to heighten and focus on that while maybe even minimizing the toxicity of the relationship that you're experiencing. And it doesn't help that you might be in a relationship with a person who's also minimizing it too. Oh, it wasn't that bad. I only cheated that one time, or I didn't mean to hurt you, or I didn't say that, right? They might even negate some of the things that they have done, right? Through their own tactics they use to kind of keep you in that relationship. It's a really tough relationship to be in, and it's really tough to get out of and heal from and grieve. I think it's something that if you have experienced that relationship, first, I'm so sorry for you. That is really difficult. And I want people to really think through using that term so it doesn't minimize and invalidate people's experiences who have gone through those patterns of behaviors with individual.
For anyone who's stuck in an unhealthy relationship dynamic, whether it is someone with true narcissistic traits or NPD, or just an unhealthy dynamic that is marked by lying, cheating, all of these things that are unhealthy and that no one should put up with if it's not within your values to put up with it, right? What are some general suggestions you would make if someone is trying to break free from those cycles?
That's a really good question, right? Because we talked about intermittent reinforcement previously, right? So your brain can become addicted to that person in a way, hoping that the good will come back. And so you have to grieve that hope and recognize that, hey, this person that I'm with has demonstrated a cycle of maybe hot and cold behavior. Some people have used terms like the Dr. Jekyll and Mr. Hyde. I don't know if you're familiar with that. The two types of individuals. So you have to grieve the hope of that person being that kind, loving person that they were in the very beginning consistently, and recognize that this person, as much as they are the kind, loving person to you sometimes, they are also the mean, defensive, hurtful person. And what I've noticed when I have like patients who stay in this relationship, what ends up happening is that the person that they fell for at first, they start to see that person slow less and less, and they start to see the mean, minimizing, gaslighting, blame shifting, toxic dynamic more and more, right? And so that's when that breadcrumbing situation starts to happen where it was, wow, our relationship would go well for months, and then after a few days it wouldn't be good. So now it's like a few days it's good and months it's not sustainable, right? So to go back to your question, Dr. Johnson, you have to break the hope that this person is going to be that consistent present person that they were in the beginning, the person that you fell for and hoped for. Recognize that people with narcissistic traits and narcissistic personality disorder typically don't go to therapy. And if they do, those traits are very difficult to change, right? Because it can become a part of their personality in a way. I describe it in this way: like I'm a extroverted, outgoing person. I like to, socialize with different people. If someone said, "Hey, now I want you to be introverted and stay to yourself," that would be difficult for me, right? That's part of my personality is conversing with people and getting to know their stories. And now you're asking me to like be by myself and not converse with people. That would be hard. So similar with somebody with narcissistic traits, right? They patterns of it is entitlement and grandiosity and arrogance and lack of empathy, right? They could put on a mask and pretend to be kind and empathetic and compassionate for some time, but again, it's just a mask. And so grieving that person and the hope of that person being who you wanted them to be is going to be key. Um, and accepting that they won't change, right? If you're a person of faith, right, relying on your faith to get you through, whether it's prayer, Bible reading, meditation. Um, but I think the key is to give up the hope of that person being the who you wanted them to be.
And I think that makes a lot of sense, especially if a person isn't seeing any effort put in towards changing. Because to your point, I do think a lot of these traits are difficult to change if a person doesn't have insight into the fact that it's an issue, right? And then if they do have insight and a willingness to do the work, then some movement can happen. But if there's no insight and no willingness to do the work, obviously, like nothing is going to like occur. And I just bring up that point because I don't want people to think, okay, well, I have NPD or I know someone with NPD. There's like no hope, like it's not going to happen. If there's insight that you have this issue and there's a willingness to work on it, you can. It's just going to take like effort to do it. There is that capacity there if there's like insight and a willingness to like engage and care. I think what's important distinction too is what you say about the love bombing is because sometimes people will come back and like pretend like they're going to do something about it. But the way that they pretend is by doing all the same stuff that got you trapped to begin with. It's like, here are the flowers, here are the things. And then when you're like, no, we're going to go to therapy and get a job and like, all of this stuff that like actually would like improve the relationship. That's where you see them dragging their feet.
No, I agree with you. And usually what makes people with narcissistic tendencies or NPD challenging to treat is because the lack of introspection. Again, they don't think they are the problem. And if they are saying they're the problem, in some cases they're doing so to get you back and that love bombing dynamic and continue on that cycle of abuse. And so you really have to see it as like whether if a person has those symptoms and they want to change for themselves, right, that is on them. But for you, if you're dealing with somebody who's engaging in those patterns, you have to see it as there's no hope for your relationship dynamic with them to ever go beyond that. You have to move on because it's a difficult relationship dynamic that can go on for a long time, right? Sometimes even decades. And that is one of the strategies that can be used, right? I'm going to change. And so you won't be able to really see that unless you invest in that relationship some more. And that its own terminology, right? Future faking, right? I'll give you what you're looking for. I'll be the person you want. I'll give you the marriage you're looking for. And so all of these dynamics can be still used as a way to manipulate the victim. So if you consider yourself a person who is experiencing narcissistic abuse, you have to recognize that even the idea of them saying they'll change can be used as a tactic to continue to hurt you. And so when you recognize that, it allows you to start to grieve the person that you want them to be and grieve the hope. But if I agree, right? In some cases, if somebody wants to change for themselves, which again, like really hard, the same way I said, like, I'm an extrovert, it'd be really hard to make me an introvert, right? Like that, I really want to drill the point for people who are experiencing narcissistic abuse that grieving the hope is a big part of healing from it.
And so, grieving the hope, and I know you brought up community, faith, those sorts of things. What are other, if any, suggestions that you would make if someone is like, okay, I'm trying to adopt this mentality that my partner is not going to become who I need and want them to be like in this relationship. Maybe they're getting support from their friends. If they are a person of faith, they're engaging in that community as well. Are there other things that you would suggest that can kind of help them through that process?
It depends. I know we've been talking a lot about a romantic partner. It could also happen in a family dynamic too, and you can't necessarily leave a family dynamic. So figuring out boundaries for yourself, right? What is it you are willing to engage in with that person? Whether some people have decided to go no contact with an individual, and that's completely okay, and that's your choice. Some people, there's other terms like gray rocking, where I'm not going to allow this person to get any access to my emotions, because sometimes that person with narcissistic tendencies can feed on that, right? Your anger or upsetness or dysregulation. So I'm just gonna be, just calm, cool, calm, and collected. Hi, how are you? Like a gray rock. I'm not gonna have any interest, and I'm not gonna be interesting for the narcissist, right? You could yellow rock, right? You're still kind of cool, collected, but like, please, thank you, right? Those are different strategies that you can use in that dynamic. Again, no contact, gray rocking, yellow rocking. Those are helpful strategies. I think also continuing to educate yourself about it. Some of the times I've given homework assignment because euphoric recall is real and it's something I know we've talked about earlier in this podcast, Dr. Johnson. I will have that person write down all the things that that person has done to them. So when euphoric recall comes back, well, they bought me flowers, or she got me this really great present, right? Your brain wants love, which is completely understandable and acceptable and beautiful about our brains. But like it could be also hurtful if it wants love from somebody who's not healthy for us. So maybe going through that list of things in which ways in which that person has hurt you and reading it if you're feeling like you're missing them or you're engaging in euphoric recall would be helpful too. So those are a few strategies. I think if you have access to it, therapy would be helpful. Continue to go to your support systems, educate yourself, right? And also just like show yourself compassion. A lot of times when people are in narcissistic relationships, they've abandoned themselves to meet the needs of someone else, right? Now this is your time to pour into yourself. What is it that you like or love? Start to center yourself. Take yourself out, maybe go on a vacation, recenter your own needs and be kind to yourself and let your inner voice be kind to itself too. I tell my clients all the time, I want you to talk to yourself like you would talk to your best friend, right? And so have your thoughts reflect the way you would talk to your best friend.
I love all your terms for things, the euphoric recall. Because what I say to my patient, like I do pros and cons with them. And one of the things that I say to my patients all the time is the pros don't matter, it's the cons. And I said, it doesn't matter how good something is if it's not worth the cost. And the cost of it are the consequences. And if you're not willing or able to deal with the consequences, then it is not for you. Like whatever it is, it's not for you. So like really sitting down and going, here are all these like consequences of being in this dynamic. Here are all the pros, right? But again, are the pros worth that cost? That's a personal decision that I think each person has to make for themselves based on their own values.
It is a really good point. I wish I made up that term, but that's a term that's in the literature around dealing with narcissistic relationships and such. But yes, no, I like that. But I know with Gottman's Institute and research, I know we both use their information to help our clients when it comes to relationship dynamics. They talked about a healthy relationship has a 5 to 1, 5 positive to 1 negative ratio, right? And so if you have 5 positives, but this negative is that they is so damaging, right? And usually 5 to 1 ratios talking about micro behaviors, not necessarily like events. So but that's how that study looked at that situation. But yeah, focusing on the cons. What are the consequences of this action? So it's not just this 1 to 1 thing. Well, they bought me flowers, but they called me a name, right? That calling you a name, right? How does that make you feel? What are the consequences of that behavior? Yeah, it has an impact on your body. It can be really toxic for our nervous system to be in those dynamics.
For sure. I think you're bringing up a point. I think we're both kind of talking about the same point, which is you get to decide for you how heavily weighted these pros and these consequences are. You could have a person that has 1,000 pros, but if the consequence is they, physically abuse you, you go, well, I don't want to get physically abused in order to get all of these positives. I'm out of here kind of situation. Or you can have someone where, let's say they're late all the time, and it drives you crazy, but you're like, okay, I can learn how to work with somebody who's like late all the time, or someone who has smelly feet, or like whatever it is, and so there's consequences that are workable consequences for a person. And then there's consequences that are absolutely not.
Yeah, absolutely. And so I love that you said that because earlier you're talking about what are like an unhealthy relationship versus like a narcissistic relationship, right? Maybe an unhealthy relationship is like, hey, they are late all the time, or I like to go out, they like to stay in. Well, that's not even an unhealthy relationship. It's more like we have different interests, right? I'd have to explore that relationship more. But yeah, right? Like what are your boundaries? Another question you can ask yourself is, would you want someone to treat your best friend like this, or your child, or your someone you really love and care for like this? And so even if they have all these great qualities to them, right? Maybe they're by a superficial standpoint, they're tall, attractive, they have power, status, money, a good career, right? But they are hurting you verbally, emotionally, mentally, physically. Those are some big cons to a person. Yeah, and that's something that I would want you to really reevaluate, because again, a lot of times people are abandoning themselves for these relationships. So reflecting and thinking about what your own boundaries would be, what would be your non-negotiables, and if somebody's hitting a non-negotiable, it's time to leave, not work through that.
Yeah, and as you said a few minutes ago, recentering yourself, in terms of recentering yourself in your own life, but also reflecting on like, who am I? What are my needs? What do I bring to a all of those things? Because I try to tell my patients all the time, the answer exists within you. Like we're going to spend some time like exploring this and figuring it out, but the answers to your life are informed by your environment, but it's going to come from you.
Yeah. No, agreed.
So yeah, I just want to say thank you so much for this conversation today. It's given me some more ideas on how to like work with some of my patients and these issues that like come up for them. Whether it truly be they're maybe dating someone who has narcissistic traits, or they're dating someone who is engaging in this kind of modern dating situation that we find ourselves in that can sometimes encourage people to devalue others. Both of these dynamics, the whole spectrum of that dynamic can cause harm. And also thank you for mentioning too that it's not just romantic relationship dynamics. If you have a close family member that is exhibiting these things, everything that we're talking about applies. It just may apply slightly differently because like you said, you may not be able to go no contact with your mom, but obviously someone who you're dating, no contact is an option. So you really have to look at your situation, the context, the nuances that exist within your life, and then pick whatever interventions or strategies that make sense. So, Dr. Cyril, while I still have you, if somebody wanted to work with you or find you anywhere, like, are there any places they can search you out on Google?
Oh, that's a good question. Right now, they could probably go find me through Psychology Today. That's where a good portion of inquiries I get come from. So yeah, I think that would be it. So my name is Khadijah Cyril. You can find me on there. I appreciate that.
If you enjoyed this interview and you'd like to see me interview other people on other topics, please let me know via my Instagram at KindMindPsych or via my email at psychologist@quickanddirtytips.com. The Savvy Psychologist is the Quick and Dirty Tips podcast. It's audio engineered by Steve Rickyberg. The director of podcasts is Holly Hutchings. Our podcast and advertising operations specialist is Morgan Christensen. And Nathaniel Hoops is our marketing contractor. Follow Savvy Psychologist on Apple Podcasts, Spotify, or wherever you listen to podcasts. That's all for this episode of Savvy Psychologist. Thanks for listening, and I'll see you next week.